Did you know that individuals with HIV are at an increased risk for various infections, including meningitis? Our immune system is a complex network of cells and proteins that defends the body against infection. Central to this defense are CD4 cells, often referred to as T cells, which coordinate the body's immune response. However, HIV weakens the immune system by directly attacking these crucial guardians. Imagine this. Your immune system is like a castle, and the CD4 cells are the knights protecting it. When HIV infiltrates, it's as if a traitor opens the castle doors, allowing enemies to swarm in. These enemies can take the form of various infections, including the opportunistic ones that may cause meningitis. For individuals with HIV, especially those with a low count of these nightly CD4 cells, the castle's defenses are compromised, making them more susceptible to these infections. So, as you can see, HIV significantly increases the risk of infections, including potentially life-threatening ones like meningitis. Now, let's delve into the types of meningitis that HIV-positive individuals are more susceptible to. First up is bacterial meningitis. This is an increased risk for those with HIV, especially when CD4 cell counts are low. Common culprits include bacteria like Streptococcus pneumoniae and Neisseria meningitidis. Next, we have viral meningitis. Certain viruses, including the herpes simplex virus, cytomegalovirus, and varicella zoster virus, can cause meningitis in people with HIV. The severity of these infections can be heightened due to a weakened immune system. Last, but certainly not least, is cryptococcal meningitis. This fungal infection is caused by Cryptococcus neoformans, a fungus found in soil and bird droppings. It's a particularly common and serious concern for those with advanced HIV disease or low CD4 cell counts. In essence, the variety of meningitis-causing pathogens poses a significant threat to HIV-positive individuals due to their compromised immunity. So, how can we prevent meningitis in HIV-positive individuals? The answer lies in the strategic deployment of two vital tools: the shield and the sword. The shield in this case represents antiretroviral therapy, or ART. This is a form of treatment that helps control the HIV virus, thereby preserving the immune system and reducing the risk of opportunistic infections such as meningitis. On the other hand, the sword symbolizes vaccinations. Vaccines function as a defensive weapon against common bacterial causes of meningitis, like Streptococcus pneumonia and Neisseria meningitidis. They equip the immune system with the information it needs to recognize and fight off these invaders before they can cause harm. For individuals with advanced HIV disease, an additional layer of protection may be necessary. This is where prophylactic medications come in, serving as a protective measure against specific infections that can lead to meningitis. Prevention, hence, involves a combination of HIV management, vaccinations, and in some cases, prophylactic medications. Early detection and treatment are key in managing meningitis in HIV patients. Recognizing the signs and symptoms of meningitis is paramount. These may include fever, headache, neck stiffness, and altered mental status. If you or someone you know is experiencing these symptoms, immediate medical attention should be sought. Regular monitoring of CD4 cell counts and viral loads also plays a significant role in the management of this condition. You see, these indicators help healthcare providers assess the immune status of an individual, allowing them to adjust treatment strategies accordingly. In a world where HIV patients are more susceptible to infections such as meningitis, proactive steps like these are not just important, they are life-saving. Regular checkups, prompt action at the sign of symptoms, and closely working with healthcare professionals can make a world of difference. As we've discussed, early detection and treatment of meningitis in HIV patients is crucial and can significantly improve outcomes.